Hello, I'm Dr. Jonathan Weiler, here with Heather, one of our wonderful patients, and today we're going to discuss the use of neurotoxins in the face. Neurotoxins are commonly known as Botox. Botox is more of a brand name for an overall family of neurotoxins, but it's the #1 neurotoxin used in the face. First, I tell patients there's never been a reported adverse event from neurotoxin used in the face. Botox, aka neurotoxin, is used all over the body in different quantities all throughout the body. And there have been some adverse reactions reported. But in terms of cosmetic facial purposes, there's never been an adverse event reported due to the neurotoxin. So what I tell my patients is, think of your face in harmony. The face is composed of lots of different muscles, and these muscles are in harmony. As you age, some of these muscles start to overpower other muscles in the face. And a good example I like to use with patients is the crow's feet out here. So patients with a lot of expression oftentimes will get fine lines and wrinkles on the lateral aspects of the eye. And that's due to a constant contraction of this muscle. The muscle around the eye, think of it like a large circle. It encompasses the entire eye and goes all the way around. But it's strongest at this point out here. When you smile, when you laugh, it causes wrinkles and fine lines. Can you do that, demonstrate? So she's got a great demonstrable crow's feet out here. And so what Botox does is it's injected in very small quantities through the smallest needle available. Typically we inject 3 to 4 areas, or 3 to 4 times per area. This together is considered one area. And it takes its effect in approximately 5 to 7 days. And what Botox does is it sort of temporarily paralyzes those muscles. Now, paralyzes it scares people, and it's a bad word. But think of it like this. These lines are being caused by the contraction of this muscle. And what we're going to do is we're just going to take that toxin and just cause a temporary paralysis in 3 little areas. That's going to prevent that muscle from contracting, and that's going to eliminate those fine lines and wrinkles. Now, this is a temporary paralysis. It lasts approximately 3 to 4 months, so this procedure does have to be repeated every 3 to 4 months. But what I tell patients is the more that you use it, the more effective it becomes. So oftentimes, if you go through a series of treatments, you can lengthen that treatment time. Now, Botox is primarily used in 3 specific areas in the face. One is the crow's feet. Smile for us and demonstrate that. Good. The second area is the glabellar. This is considered right here. You've got 3 large muscles. She's got a nice little crease through here. Exactly. And then the third spot is the brow, and elevate. There you go. And so this is an area commonly, these 3 areas we treat together. They can be treated individually. They can be treated at different sort of depths and different quantities, so we can induce different states or different appearances in the face. So we have the ability to elevate the lateral brow. We have the ability to smooth these lines through here, and we have the ability to smooth these lines through here. So Piper, one of our PAs here at Weiler Plastic Surgery, is going to demonstrate and actually perform the procedure for us today right now.
Hello, my name is Piper. I'm a physician assistant with Weiler Plastic Surgery here with Heather. Today what we're going to do is some Botox to her glabella, her forehead, and her crow's feet. First thing what we'll do is we will clean the areas, and then we will mark the areas out with our injection points. Okay, Heather, make a mean face for me. One more time, make a mean face. Typically here in the glabella, we'll do about 5 injection points, and those can be used just to guide us. Good. And make a surprised face. Raise your brows for me. Great. All right. First, what we'll do is we will start with the glabella here in the middle. If you will, just turn your face just a little bit. All right, and just a little stick. 1, 2, 3. so that's your glabella. We're done with your glabella. I'm going to do a couple on your forehead. Good, and one more on your forehead and we'll be done. It's important when you get home this evening to not massage these areas. You never want to massage where you had the injection and spread the medication to an area that it was not intended to go. All right, so far so good? Mm-hmm. Good. Okay. Three and you'll be done with these. Good. And we're all done with Botox.
My name's Heather, and I just had my first Botox procedure on my forehead and around my eyes, and it was relatively painless.